Hello, this is Glenn Gruby, and today we're going to talk about leaky gut and thyroid disease. And this is a very important topic for you to understand because two reasons. One, is very common for people with thyroid disease to have leaky gut, and leaky gut is actually a gateway of inflammation that is often at the root cause of a thyroid condition. So if we want to try to improve the thyroid condition, it's important to know if we have leaky gut and take steps to correct it. So you might not be feeling well, and you might not be feeling well even if you have normal labs according to your doctor. It's actually very common for doctors to say, oh, you're fine, but you don't feel fine. And you start asking yourselves a lot of questions. And one of the things that can be going on is leaky gut, and that might not show up in a regular lab test that you have done for your thyroid for a number of reasons. So we're going to take a look at that topic today. So our goals today are to talk about what leaky gut syndrome is and what are the symptoms of it and what causes it, and then finally how we can get tested for that. So a couple of facts. First of all, it's actually rare for a person with a chronic medical condition to not have leaky gut syndrome. And the reason for this is many chronic conditions start with leaky gut, and the inflammation that may be coming with a chronic condition can also contribute to leaky gut. So it's a two-way street, but it's something that's very centrally important to your health. The average person may suffer for years because of doctors simply treating the symptoms and not getting to the root cause of their disease. Remember that doctors, when they name a disease and they work with a medicine or a treatment for the symptoms of that, they really don't ask why that condition has happened in the first place. And often leaky gut is the reason why. So if we want to hope to get better, we need to, again, address that. So if we think of your intestinal lining, your small intestine lining, as a fence, you want the fence to do a specific job, which is to keep invaders out. And this fence is not doing such a good job of that because it's broken. It has one of the pickets missing, and animals are going to get in and cause a little bit of a stir in your family. Similarly with your gut, if there are holes in the cellular lining of your small intestine, things will get into your bloodstream that aren't supposed to get into and create inflammation and wreak a little bit of havoc. So let's take a look at this picture. Up here we see imagine that this is the tube of the small intestine, and your food that you're digesting is in here, and it wants to get into the bloodstream so that it can nourish you. And normally it would do that through this lock and key system. It's kind of like the Panama Canal. It opens a little bit and then it closes, and it's called a tight junction, and it's meant to allow very small food particles to get into your bloodstream where then they can nourish you and feed you. But leaky gut is a condition where that system is broken here, and larger things are getting through, and maybe viruses and bacteria are getting through, and your body doesn't like that. So it mounts an immune reaction to the foods that are undigested coming in, or virus particles or bacterial particles, and that creates inflammation, and that creates problems, and your immune system goes on alert, and that can even eventually lead to an autoimmune condition. So some of the signs and symptoms of leaky gut you may see: facial swelling upon exposure to strong smells, bloating, gas, and cramps shortly after eating, alternating constipation and diarrhea, immune system imbalances including autoimmune disease, muscle aches, foggy thinking, ADD or ADHD, poor sleep, food cravings, headaches, irritability, arthritis, joint aches. And some of these you might see right away after eating a food, or some you might see a delayed. It's very common if people have headaches in the morning or the next day after eating particular foods, that they may have a leaky gut. And you'll notice here that a lot of these symptoms are not related to your gut. You can actually not have any stomach pain at all, think you have perfect digestion, but in fact have leaky gut. And that's where the testing might become important to convince somebody that it's an avenue that needs to be addressed and taken care of. So what are the triggers of leaky gut syndrome? In general, this is all going to fall under the realm of stressors to the body of numerous different types. stress in general causes a weakness in the protective lining of the gut that makes us more vulnerable to getting attacks by various different things and conditions. So first thing we look at is your history. Chronic use of antibiotics is a very big contributor to leaky gut. Things that cause dysbiosis in your body, basically meaning an improper mix of good and bad bacteria, will contribute to leaky gut. Research shows that concussion actually causes a leaky gut very quickly. Chronic inflammation, nutrient deficiencies, heavy metal exposure. The next thing we look at is your diet, and gluten is the most common food trigger that can create that inflammatory state and cause leaky gut, but it can also be caused by a chronic junk food diet, or really any foods that are inflammatory to you. Lifestyle is the next thing. Chronic stress, too much alcohol. It is believed that alcoholics almost universally have leaky gut, and sleep deprivation as well. So the problem here is the progression of leaky gut. You start with the leaky gut. That can lead to increased food intolerances where people are not able to eat foods they used to be able to eat, immune abnormalities, and eventually can lead to an autoimmune condition. And this is very commonly true with people that have Hashimoto's thyroiditis. Speaking about autoimmune disease, the top researcher in the field, Harvard medical doctor Alessio Fasano, his contention is that there are three things you actually need to get an autoimmune disease. One is a genetic predisposition to the disease. The next is an environmental trigger. This can be a food, it can be a toxin in the environment, it can be an infectious agent. And then you need a leaky gut, because the leaky gut is the gateway to inflammation to the whole body that causes the immune system to become dysregulated. So what are some conditions linked to leaky gut? Autoimmune disease is big. Chronic fatigue syndrome. These are all the chronic disease states of the 21st century. And even things like food allergies or even other types of allergies when they're chronic, that can be indicative of that. Skin problems also. Chronic eczema, psoriasis are examples of suppressed or irregular immune function. And in those conditions, if you suffer from these, it's a good chance you have leaky gut, something to investigate. So how do we test for it? There's actually a test. This is the blood test by Cyrex Laboratories, which is arguably the leading autoimmune laboratory in the country. And they have a test where they draw your blood and they can look at these markers. And we saw that drawing before where the lock and key system, that's this occluded and zonulin, can get damaged. And if they are damaged, those fragments show up in the blood out of range. And this would indicate that that system is damaged. And this actomyosin would indicate that that cellular integrity has been compromised as well. This measures different bacterial agents that may be in your blood causing a leaky gut as well. So it's a pretty good test. I don't test this on all patients, but sometimes I think it's a good idea. Certainly if somebody is not sure if they have leaky gut or they're reluctant to follow some type of a leaky gut protocol, which requires a little bit of dedication on their part, we will test for this. But I find that this is very common to be the case with people with autoimmune disease, virtually everybody. So let's summarize a little bit what we talked about. It's important for you to understand that leaky gut is a result of many variables related to diet and lifestyle. And we talked about what those are, and I'd encourage you to go back and watch this again. The symptoms of it can be quite widespread due to the central nature of the problem. And often you will see neurological symptoms more commonly than you will see gut symptoms. Same thing with gluten sensitivity. 70% of people that have gluten sensitivity have neurological symptoms, not gastrointestinal symptoms. So don't think that leaky gut always means you're going to feel digestive symptoms. You might not. There are new testing techniques that can accurately identify leaky gut and allows us to have an easy to follow, affordable, and comprehensive lifestyle strategy that's very effective for approaching leaky gut syndrome. So what's your strategy moving forward? If you found out you did have leaky gut, really you need to work with someone that can help you with this. I think it's very difficult to heal leaky gut completely on your own. You almost need a coach to help you through this. But the basic strategies, we want to reduce stress and inflammation, and we want to normalize insulin levels because blood sugar imbalance is a big cause of leaky gut as well. We want to remove any offending pathogens that might be in the digestive tract. We want to remove any inflammatory food triggers. We want to rebalance the gut microbiome, which means the mix of good and bad bacteria. And we can put a targeted strategy together for you based on functional testing, which will give us a good indication of what are the likely causes and contributors to your leaky gut. I have found that for those with chronic disease, it's very hard to overcome. It's very hard to make a lot of progress without addressing the gut and the leaky gut syndrome. And that's really because all health begins in the gut, as Hippocrates said. And as they've known in China for 2,000 years, the health of the digestion really determines the health of the body. So I want to thank you for listening to this short video in our thyroid education series. If you'd like any more information about this topic, or there's anything we can do to answer questions or help, please look us up online, FHAInstitute.com. And thank you for watching.